Mental health care. For decades now, Peninsula Regional Medical Center has offered inpatient treatment for adults. But now, thanks to a new partnership as well as donations, it appears they now have treatment options for kids and teenagers. 47 ABC's Lily Zhang joins us live outside of Peninsula Regional to explain. Lily?
Hey, Emily, that's right. This new unit offers services for teens and adolescents in terms of outpatient services. Now, they have been in operation for about a month and a half now, but just today was their official debut for the media. And it appears a lot of the issues that they are tackling mirror the ones that are very common disorders across teens in the U.S. Hyperactivity, depression, and anxiety.
It runs the gamut.
These are just a few issues tackled at the Rebecca and Leighton Moore Child and Adolescent Outpatient Behavioral Health Unit. It's through a joint partnership between Peninsula Regional Medical Center and Avantis Healthcare. Kevin Young is president of Behavioral Health and Wellness Services at Avantis Healthcare. He says the new Adolescent Outpatient Center has the ability to treat patients outside of hospital walls.
There's different transitional things that occur with an adolescent or a child when they're at school and then when they go home. And so being able to collaborate with both those areas is really best for the child. So partnering with pediatricians as well, that's what's different about this.
Leighton Moore, chair of the Peninsula Regional Medical Center Foundation, says the new unit costs about $432,000. At first glance, it looks pretty standard, just a couple of examination rooms. But considering the latest mental health statistics, what happens in this unit is priceless. According to the most recent numbers from the National Institute of Mental Health, an estimated 2.8 million adolescents in the U.S. between the ages of 12 and 17 had at least one major depressive episode in the past year.
There's so many people, even in families or even the families that that have a mental issue with one or two or more people. You can't think of any group of people that isn't affected by it in some way, and you need a place to treat any type of illness.
Illnesses doctors say they still have to take case by case.
I think being a child and an adolescent, it's very difficult these days, and I think there are new challenges for these kids that maybe when I was a kid didn't exist.
Now, while these services right now are outpatient services for teens, Leighton Moore tells us that one day in the future he would like to see if a future center or possibly a wing would be able to cater to inpatient services. Emily?
All right, thank you so much, Lily. 47 ABC's Lily Zhang reporting live outside PRMC in Salisbury tonight.